want to make something really clear. All right. So, what muscle is this? Who could tell me?
Gastrocnemius.
Gastrocnemius. How many joints does it cross?
2.
2. What 2 actions, therefore, can it create?
Well, the plantar flexion
Thank you. The obvious one, yep.
and flexion of the knee.
Yeah, she's 100% right. Reaches across the knee, can cause this leg to bend if it wanted to. That's not its main job. Its main job is to come down here in the heel and hook in here. This is called the Achilles tendon or the calcaneal tendon. It is shared by the plantaris, the soleus, and the gastrocnemius. They all come together into this tendon. If I cut this tendon down here, I've cut the tendon for all 3 muscles. They all converge and share, okay? So let's take off the gastrocnemius. What's this muscle underneath that does not cross the knee joint, underneath, that still goes down into the Achilles tendon?
The soleus?
Yeah, soleus, absolutely. Good job. So, if we pull off the soleus, there are still muscles below, and we've never talked about these. And these muscles below, there's 3. Well, there's actually a little bit more, but let's keep it simple right now. There's 3 muscles below here that are deep to these calf muscles, and they actually have tendons that run around your medial malleolus. You have some that run around your lateral too, and reach underneath your foot. Now, why would they reach underneath your foot? Because they go and connect to the bottom of your foot and your toes. And what do you call it if you bend your toes down? You should know this if you just apply, what do you call when I bend my fingers?
A flexion?
Yes, it is a flexion, yeah. So it works the same way. So this is flexing my toes. When you scrunch up your toes, that's flexing. When you lift them out, that's extending. Anyway, in order to flex them, I would need tendons down here, correct? I can't pull something unless I'm down here. And that tendon is quite literally hooked to my toes and running around my malleolus and up my leg. So there's really a tendon that comes down here, goes around my ankle. You can't, it doesn't show in this thing, but the point is, there are muscles here that move my feet here because the tendons run down underneath here and hook to 3 places. And we're going to do these muscles separately, but this is just kind of an answer to the homework. And I want you to realize that there's not a lot of, there are muscles in your feet, but obviously all the power isn't coming from there. The power is coming from up here. And we're going to find the same thing is true for hands. My hands are really being puppeted from strings down here, right? The muscles are pulling here, and they're pulling strings that are pulling my fingers. Anyway, you've got, you know how you have a tibialis anterior tibialis in the front? Well, you've got a tibialis posterior. It actually reaches underneath here and reaches into the arch of your foot. The arch of your foot under here, that's why you want to really get down into arches. So it too helps with a plantar flexion. Also helps with arch support and things like that. Then you've got a flexor digitorum longus. What do you suppose a flexor digitorum longus does?
Flexes in the foot?
Yeah, flexes the digits of the foot.
Yeah.
It is a long muscle that attaches into your toes, not your big toe, and it pulls on them, and it's the flexor digitorum longus, and it flexes the digits of your foot. Then you've got a flexor hallucis longus. What do you suppose that muscle does?
For your
Is
big
that for
toe?
the thumb?
Yeah.
So, yeah.
Yeah, well, I love what both of you are saying. It is for your big toe. Any muscle with the word hallucis in it, this is something you want to stick in your head for the rest of your life, because it's an easy 7 muscles right here. There are 7 muscles that work your big toe. They all have the word hallucis in them. There is no other muscle in the body with the word hallucis in it. If it says hallucis, you can guarantee it's at least attaching to your big toe and moving it in some way. There are 8 muscles that move your thumb, and they all have the word pollicis in them, with a P. Hallucis big toe, pollicis thumb. That's 15 muscles that you don't have to completely memorize, because somebody walks in and they go, pollicis, trying to trick you, and you're like, oh, thumb muscle. It's got to be somewhere around here. It's got to be in my thumb pads, I'll explain later, or it's got to be up here. Somebody comes in, blah, 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 trying to show off their anatomy, hallucis, and you're like, oh, it's a foot muscle. It's got to be somewhere going to the big toe, right? And I know to go down there immediately. So that's a very helpful thing. So flexor hallucis longus is just back here and reaches underneath and grabs on the big toe. But because it grabs on the big toe, it too helps with the plantar flexion. That's not its main job. Its main job is to pull the toe down, right? But it can help with the plantar flexion because it's pulling stuff down. So you have 3 calf muscles that help with plantar flexion, but you also have a tibialis posterior and a flexor hallucis longus and a flexor digitorum longus, which we'll talk about later, but I just want to give you some kind of stuff to think about. So there's a lot of stuff in here. That's one of the things I want to talk about. That's all. Questions about that, comments about that, thoughts about that? Okay. Let me ask you, let's see if we can do this. That's pretty thick, right? What's the best way to get through this to get to these? Right here. What's this mean, Miss Harper?
I mean, like on the side of the...
That is one thing, yes. Absolutely. The sides is a good way to go, which is part of the answer for the soleus, right? To get to the soleus, you can hit stuff from the sides. Don't forget that. So just don't go through them. But if I wanted to go through these, what position should I put the foot in to make these loose?
You put the toes up. Like when the body is face down.
Doesn't matter if the body's face down or whatever. What position do I put the ankle in?
How can I describe it?
It's either plantar flexion, dorsiflexion, inversion, or eversion. There's only 4 things I can think of foot doing.
Oh.
Yes, Miss Stanley.
Dorsiflexion?
So pull it back like this. Pull
Pull
your foot back. Pull your foot back like
that.
that.
Plantar then, because I had them mixed up.
But I understand why you got it mixed up. So we're going to talk about that today, everybody, because this is very confusing but very simple. So if you guys do a plantar flexion, does it make your calves tight? If you do a plantar flexion under your own power.
Yes.
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 Thank you. But if you're laying there being lazy and I come over to your house, which would be weird, but if I come over to your house and I do a plantar flexion for you, does it make your calves tight? No. It puts them in a loose position because I put them where they would be contracted, but you're not contracting them, so there's all this loose rope. Does that make sense? I'm seeing some ahs. Okay, that concept is very important because it's a little bit confusing because we're always like, well, but that's the position that would make it tight. Yes, if the person does it, it makes it tight, right? If the person's muscle is pulling, then the muscle stays tight. But if you move the thing and the muscle's not pulling, then you've got all this slack. So if I put a client in a plantar flexion, don't have the client do it, I put the client in a plantar flexion, this stuff is all loose, and that's very helpful to me if I want to get through it to get to the deeper muscles. Right? In fact, if I dorsiflex this, I'm going to make this all tight, and then I've got to fight through this to get into the flexor hallucis, hallucis longus, flexor digitorum longus, tibialis posterior. Does that make sense? And the reason I'm telling you this is because you guys, if you're really good therapists, will use this stuff. Right? So for Yes. Miss Walker, please.
Does that mean, so for your quadriceps and your hamstrings?
It applies to everything, actually. I mean, the movements might be different, but it applies to everything.
Right, so for those to be relaxed, would your leg just be extended like it is on the table?
Yes, for your quads, even though your quads extend your leg, if you extend the person's legs, they're going to be all floppy. Touch your legs right now if you're laying in bed. Your quads should be all floppy if they're straightened out. Now, if you flex them, they're not. But yes, that's the idea. And so if I wanted to get to your deeper quad muscles, I would definitely want some of the ones on top loose. Yeah. So let's take a simple example and see if we get this. This is not in the leg. This is an area that you guys are very familiar with. The upper body. What two muscles do I have right here? Thank you. I saw somebody mouth it. Somebody say it now. Be brave.
Your pecs.
Yeah, pec major and minor. Which one attaches to my arm?
Minor.
Minor? Major?
Major. Major attaches to my arm, minor attaches to my scapula. So quite often, by the way, believe it or not, majors are easy to get to. The major is most superficial, right? So every time I touch your chest, I'm touching your major. What if I want to get to the minor? Do I want your arm way out like this?
No, you want it closer.
Thank
Closer
you.
your arm.
I don't want them closing it because then they'll be tightening it. But I want it close. Let your arm come in really close and feel how loose your pec is. If you're not doing it, it's loose. If you put it out here, it's kind of tight. And if you flex it, it's tight. But so if I want to get to your pec minor, you'll actually see me lift your arm and carry it in like this, so it's all loose here, and I can go through your pec major and get to your pec minor. Why is that important? Try to get through some guy's pec major that does like a 250-pound bench press. You'll never get to his pec minor. Unless he's not helping you, and you lift his arm in and it's all loose, and you go right through his pec because it's soft, and you'll penetrate the lower layer. This stuff is super important to making you a better therapist, is understand the kinesiology so that you can move stuff to get other muscles to stop fighting you. Otherwise, you're trying to go through something that's taut. If I'm stretched out like this, that muscle is taut across and it's harder to get to my pec minor. You want it loose. Hang in there. Cool? That's the concept. I think we at least understand the concept. That's good. So, let's take this concept a little further. Okay, so anybody ever been to the gym and done seated calf raises? Nobody here? Come on.
Yeah.
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 Okay, good. So seated calf raises look like this. You have a seat like this, and you put a weight across you here. There's usually a bar, and it's all fancy. But the theory is you put weights here, and you lift your toes up like this, and you're working your calves. Seated calf raises only work your soleus. Why?
Because you're bending your knee.
That is the correct answer, but why, Ms. Torres? Ms. Torres, you're right, and I think you understand why you're right. Can you explain why bending your knee would stop you from working your gastrocnemius and your plantaris, which both cross the knee joint?
Because the joint, because they need to cross the joint.
Yeah? But why does bending the knee make it so they don't work anymore?
You're contracting. No?
I don't think so. I feel like you understand it, but I don't think you're explaining it. You have your hand raised, Ms. Cooper?
No, I'm like palpating, I'm feeling.
I love it. So Ms. Torres is
So I was
right.
gonna say something.
Yeah, go ahead. Say something,
Mr.
Mr. Tate.
Tyson?
Please.
Alright, so I'm a relatively new personal trainer, I guess, because there's a lot of shit that's just going right over my head.
Yeah.
But I would say it's because you're icing it, because the muscles aren't in motion. You're just seated, so you're not using the muscles. Is that correct?
No. It's a good guess though. And I'm glad to hear you're a personal trainer because you're going to love this class. Because literally everything we will discuss will make you better at personal training. And here's an example. We're about to teach why seated calf raises do not work gastrocnemius. That does not make them a bad exercise. It's just that they are a soleus calf exercise. And the one thing you do have to be careful with is the soleus tends to always get worked, and so it can get out of balance if people do too many calf raises on a seated calf raise. But let's look at why. And it's the same reason of what I taught you here and what I talked to you about getting through the stuff. So let me show you. Let's get to our skeleton, okay? Can everybody see our skeleton? Okay. Now, this isn't going to be exact, and we're just going to try to make it work to make a point. But we're going to make a gastrocnemius here, okay? And it won't look anything like a gastrocnemius, but the point is it's going to cross the knee joint and the ankle joint, right? Now, there are two ways. By the way, if this muscle pulls, it can cause a plantar flexion, and it can cause a flexion of the knee, if it's pulling, right? Well, what happens when you sit down? Hold on. You've got a soleus underneath here. The soleus does not cross over two joints. It just crosses over one. The soleus just shares the same thing. It just crosses over one. When I sit down, look how much slack is in there. So what happens is the soleus is still working. It doesn't have any slack. Nothing changed when I sat down for the soleus. Soleus is always engaged. This guy is so slacked that even when he contracts, he's like, well, that doesn't do anything. Now, if the leg is straight when he contracts, it does something. But when the leg's bent, his contraction no longer works. We've disabled him. Which, by the way, was the answer in the homework where you guys said, if you want to get to the other muscles underneath the gastrocnemius, the other thing you can do is bend somebody's knee. This is why. It makes it soft, and you can get through the gastrocnemius and get to all the muscles down here. But because we understand our kinesiology and we understand that the gastrocnemius crosses two joints, I know how to disengage it. I can actually bend somebody's knee and make the thing floppy. And make sure that only the soleus is working. This is great if I want to get at the soleus. So I can cover the soleus from the sides, but I can also bend the knee and make the gastrocnemius loose and hit it that way too. So I usually work people's calves when they're face down, prone. And, you know, sometimes, do you guys do this too? You sometimes throw the foot on your shoulder and you sit down the table? That's great, because what have you done there? You've just disengaged the gastrocnemius so you can go right through it and get to the soleus. And you're still rubbing the gastrocnemius. But without even thinking about it, you've bent the knee, which makes the gastrocnemius loose. Anyway, that's why the gastrocnemius doesn't work in a seated calf raise, because you're like this, and it's so loose that even when it tightens, it's not enough. The soleus is always working. Always. The soleus can't disengage. Yeah. Does that make sense? Can somebody ask a question? If it doesn't, please. Oh, sorry. Hold on. Miss Walker, yes, you have your hand raised.
So when you're kind of seated in that calf or that seated calf raise, I mean, your muscle, after you sit down, your muscle is basically passive then.
Yes. The gastrocnemius is passive. It'll contract. Muscles, it's really weird to think about, but like when you guys stand up on your tippy toes, it's your heel that gets pulled that makes you stand up like 6 inches. Well, the heel only moves an inch. So when your muscles contract, believe it or not, they're only contracting about an inch or two. If I take 4 inches of slack out of there, it can contract and it doesn't do anything. It can't pick up all the slack. There's too much for it to do. So yes, it's useless at that point.
So if you were to do, what I'm wondering is if it has any difference to like whether your butt is actually sitting on anything and you're not having to use your muscle to stay in that position. So would it be the same thing as if you were to go into a squat and then do a calf raise? It still would not really work the gastrocnemius because of the angle your knee is already at?
Yeah. I mean, I like where you're going with your thinking, but the nice thing about kinesiology is it's still all about the knee. Like, nothing will change the fact that the when we're looking at any muscle, we just have to look at the joints it crosses. And if the gastrocnemius crosses the knee and the ankle, then as long as that knee is bent, it doesn't matter if you're squatting, it doesn't matter if you're combing your hair, it doesn't matter what, you know what I mean? It doesn't matter what you're doing. It's all about the angle of the knee and the angle of the ankle. That's it. Nothing will change that, if that makes sense. Now,
Yes,
as
because
you,
I was wondering if it had anything to do with whether you were, actively holding yourself in that position or not.
no, you. By the way, don't get me wrong. You're engaging a lot of other muscles by actively holding that. But now, if you come up from your squat and then stand up on your tippy toes, you're engaging all your calf muscles at that point because your leg is straight now. Miss Torres?
So, well, it's gonna be, well, yeah, of course, gonna be the same thing for the rectus femoris, right? So you're laying down and you have to bring that leg up or flex to get in there and, okay.
Thank you, Miss Torres. Yeah, thank you, Miss Torres. You're dead on right. So, let's look at the front of the leg, right? Which quad muscles just cross one joint?
Rectus femoris.
I didn't say which quad muscles cross two joints. I said which quad muscles cross one joint.
Oh, the vastus medialis, yeah, right? Intermedius.
Yeah.
And
All the vastuses. So, you got like a lateralis, it hooks to the femur and down here, right? I mean, everything, by the way, hooks to the patella and then down like this. Then you got an intermedius, hooks here, down here, right? And you got a medialis, hooks here, down here. That's what they do. If these muscles pull, what do they pull? Right? What's that action? Anybody? Somebody? Please,
An
somebody.
extension of the knee.
Thank you, an extension of the knee. Now, you've got a rectus femoris. These are not exact attachments, guys. I have to get the tape to stick. It goes to the same place too, so if it contracts too, right? It does the same thing down here. But what's the other thing it could do? It can lift your hip up, flexion of the hip. So the more down my hip is, the tighter this thing gets. So if you wanted to access the vastus intermedius, what position makes the rectus femoris loose?
the flexion of the hip.
Yeah. Get the hip up here. Look at this thing. And don't bend the knee, because that'll start to tighten it again too. Just have the hip up here like this. Now I can get to the intermedius, right? This is why when you bend somebody's leg back, when you bend their knee, you're stretching all their quads, but if you put the leg back even farther, you tend to start to emphasize the rectus femoris. It's getting more and more taut here. Yeah. This is why, guys, I told you about the iliopsoas stretch. Remember the iliopsoas stretch where you're pushing the hips forward? Here? And I said, don't bend the knee, because what will happen is the rectus femoris will get so tight it'll stop this action from happening. You won't be able to push the hips forward. You'll only be stretching the rectus femoris. I wish I knew a better way to explain that. Do we understand the general concept, though? Anybody? Nobody? Maybe? Somebody. Yes, Ms. Yanis, please.
So that all that action has to be passive though, right? Like you do it all. Because if you ask them to flex their hip, it'll make the muscle tight, right?
Yeah, thank you.
Okay.
Thank you, and I appreciate what you said, because your question and your thing is validating the information. She's exactly right. Because if I lift this hip, this is what happens. It gets nice and loose, right? But if they're lifting, they're doing it by flexing this thing, and it's going to be nice and taut. Yeah, that's why we don't teach you guys this stuff in the beginning, because in the beginning we're like, just muscles contract. And that's true, right? But we don't talk about like what happens when they don't and somebody else does the movement. So yes, it would be tight if you ask them to do the movement. So, not to confuse everybody more, but muscles can only do one thing, it's contract. That's their action. The opposite of their action stretches them. That's always true. If the therapist performs their action, it keeps them loose because it creates slack. And if they perform their action, it makes them tight because that's just what happens. Things get tight when you contract them. But yes. So, the opposite of an action stretches it, and if the therapist performs the action, it keeps that muscle loose. Because you're putting it, it's like my bicep here, everybody. I have to flex it to get my arm here, but if my arm's just loose here, there's all this slack here right now. Because there's this extra bicep hanging around that was supposed to be shortened to get here, and it's not. Okay. Cool. And all this helps you get to stuff. So my bicep is a great example. Mr. Gondaris, welcome, sir! I missed you.
Me too.
Mr. Gondaris, what are you grateful for?
Maddie was calling me.
Oh, good.
Raising me up.
Good. I love that. Thank you. And sir, what is the muscle that's found deep to the biceps brachii on the humerus, on the anterior portion of the humerus?
Brachialis.
Thank you. He's exactly right. So if I want to get to the brachialis underneath here, I don't want to fight the biceps. I would put the biceps in a nice loose fashion. They'd be all bleh, and I'd go right through them into the brachialis. They won't stop me. If the person's flexing, that's going to stop me. And if they're stretched, that's going to stop me. Right? Maybe? Somebody? Okay. All right. So, this kind of stuff allows us to get deeper into the calves, deeper into the quads. It allows us to, that means too, by the way, if you want to get to the deep 6 lateral hip rotators, what's the big muscle that's in your way?
Your gluteus maximus.
Yeah. And what's the action of the gluteus maximus?
Extend the hip.
Yeah, and laterally rotate, by the way, because it goes diagonal, so it laterally rotates. Yep. So you would actually take the leg, you know when they're laying face down and we're putting our fist in somebody's butt, you'd actually push the leg towards them to laterally rotate them to get their glutes to be loose so you could go through them to get to the deep 6 if that's your goal. Because the glutes are thick. You do not want to be trying to fight through those. And when somebody's glutes are loose, I can just take my little finger and go beep, and they're like, oh my God. I'm like, yeah, that's your piriformis. So that's where we use this kind of stuff. By the way, there are times I don't want to go through something. I want to work that thing. I might pull the leg out to make the glute tight so that I can sit there and push on it while it's in a stretch to stretch it more. Right? Putting a muscle, massage is all stretching. If I put a muscle in a stretch and then I poke it in one area, I'm stretching that area while it's in a stretch. I'm doing a micro and a macro stretch together. It's very powerful. It's one of the best things you can do. You have to be careful because it's more painful for the client, but you put a muscle in a stretch and you massage it while it's in a stretch. You're stretching a stretch. Because even me pushing down on this is stretching that tissue out. Well, if this tissue's in a stretch and then I push down on it, I'm stretching each little spot on there. That's a great way to go. So if I really want to work the pecs, I really want to work the pec major, I pull it out like this and stretch it and then strip through it here. Right? While it's stretched. Especially if I have one of those guys that's like, deeper, deeper, deeper. Okay, dude. I bend his arm out and go through there, and he's like, well, not that deep. That's what they always say. Cool?
They do, that's what they all say.
It is what they all say. It's so funny. Yeah, it's the girls you gotta be careful about. They're tough, man.
I have a friend and I give him a massage and he's like, yes, we are little bitches.
Yeah, it's true. It's true.
I'm like, you guys actually are big bitches, but you get the point.
Yeah, it's true. Cool. So that was just about the homework. Just to get you guys kind of thinking about how to get down to deeper layers, because remember, if we're only thinking on the surface, we're just doing back rubs, right? And we want to get down in. And so now you've got some clever ways to get down through some pretty thick muscles to get to lower layers. Because on the calf alone, on the posterior leg, you got the gastrocnemius, the soleus, tibialis anterior. I mean, that's 3 layers of muscle right there. Tibialis posterior, sorry. Sorry. Cool. All right, any questions before we go on to talk about bones of the foot? No? Okay. Ms. Petrie, do you have any questions? Okay. All right. So yesterday we talked about bones of the leg. Remember, all this stuff becomes important later because what's going to attach to all these bumps? Let's look about feet. Today we're going to learn about feet. And feet are, by the way, fairly similar to hands. So pay attention on feet because when we get to hands, you're going to be like, oh, wow. They're very, very similar. Okay. Let's do that now. Bump, bump, bump. Let me present here to you guys. Cool. Okay. Chapter 7, legs and feet, which really should be chapter 1 as far as I'm concerned, but whatever. I didn't write the book. Okay. However, in about a month, we're about to release an online anatomy refresher course, and it starts with the feet for this reason. Okay. Let's see. Let's talk about the feet. Hey, by the way, some of you are going to be like, yes, we do that, but some people don't. The lines that you see coming down the feet here on top, and you see them on your hands sometimes, things like that, those aren't bones. You're seeing tendons coming down. There are bones there, but the lines you see are usually the tendons coming down on people's hands. They're not the bones sticking up. Okay? All right. Hey, question for you. If a muscle is found on top of the foot, is it going to be an extensor or a flexor or possibly both?
Both. Extensor?
What'd you say, Ms. Jonas?
I said an extensor.
Yeah, it's going to be extensor all day long because I've got to be on top to pull on top. If a muscle is found on the bottom of the foot, and by the way, there are exceptions to this because there are abductors and adductors, stuff like that. But basically, if muscle is found on the bottom of the foot, it's never going to be an extensor. It's always going to be a flexor. And except with the understanding there are some abductors and adductors. But my point is, if you had to choose between flexor and extensor, always an extensor on the top, always a flexor on the bottom. Do we understand that? Cool. So, Miss Bolotic, if I have a muscle on the bottom of the foot and it can either be a flexor or extender, which one is it? On the bottom of the foot.
Extensor?
No, extensors are on the top because your toes extend out and they have to pull up. So flexor on the bottom. Good. All right, cool. Miss Moore, if I have a muscle that's on the top of the foot, is it going to be a flexor or extensor?
Extensor?
Yes. No, yes. Just stop right there. Yes, good. Because I have to be on top to pull those toes out. Good. This helps you later, by the way, not just with kinesiology, it helps you with muscles. Because sometimes people will be like, do you remember that muscle? And you'd be like, I don't actually remember that muscle. But let me give you an example. It's going to my big toe, it's short, and it extends. It's literally going to be called extensor hallucis brevis. I guarantee you. It's long and it goes to the big toe and it's on top of the foot. Well, then it's going to be extensor hallucis longus. Because if it's on top, it's an extensor. If it's on the bottom, it's a flexor. If it's long, it's longus. If it's short, it's brevis. And if it goes to all the digits, it's digitorum. If it goes to the big toe, it's hallucis. If it goes to the little toe, by the way, it's called digiti minimi. The little digit. Cool? So, Miss Stanley, if a muscle is on the bottom of the foot, is it a flexor or an extensor? I can't hear you.
I want to say It is a flexor.
It is a flexor. Good. Thank you, ma'am. Cool. Okay. Here is a top-down view of the foot. It's kind of a weird way to look at it because there's not a leg on top of it. There's not a tibia or a fibula on top of it. The tibia would actually rest directly on the talus with your malleoluses on either side. Do we all see the talus there? And the talus actually rests on top of the calcaneus, which is your heel bone. And I do want to show you a foot here. Hold on. Let me grab a foot. I've got one. The heel bone's really large. It sticks out back here, but it's actually this entire area. This is all heel bone. And a tiny bit of it actually peeks out up top. You can't see that because there's ligaments on here, but it's really big. The talus is right up here and kind of sits on top of the calcaneus, but your heel bone is huge. This is what your Achilles tendon attaches into, and it's this whole thing down here. It's very big. You can't tell that from this top-down view as well. We'll see some other views here in a second. Okay. But the calcaneus is where what three muscles insert? What three muscles insert into the calcaneus via the calcaneal tendon?
The gastrocnemius, the soleus, and the plantaris.
Thank you. And literally, all they have is this much lever right here, 1 inch here, to pull on to cause your foot to go down. That's what they do. They literally do this, except your leg wouldn't go, the whole thing would bend, but they just pull on that. Yeah, cool. Other muscles kind of come around here like this to go to the bottom of your foot on the medial side. All right, so you've got your talus, and that creates your talocrural joint. I know it should be tibial talus joint, but it's called your talocrural joint, which is your ankle joint because your leg is your crural. I hate it. Anyway, but that's your ankle joint. You got your calcaneus underneath. You've got 5 tarsal bones. So in your wrist, you've got carpals. In your feet, you've got tarsals. In your wrist, you've got carpals. In your feet, you've got tarsals. You've got 5 tarsal bones. One's called a cuboid, another one's called a navicular, and there's 3 cuneiforms. 3 cuneiforms. Since there's 3 cuneiforms, how do you suppose we're going to label them? Are we just going to be like, oh, it's one of the cuneiforms? How would you label these cuneiforms since there's 3 of them? Yes, Miss Fleeks Osuna, please.
I was thinking between medial and lateral.
I love that. And how about we call the middle one between the medial and lateral one, we'll call that middle.
Oh, okay.
No, it's great. I'm trying to be silly, but that was great. You're absolutely right. So you've got a medial cuneiform, a lateral cuneiform, and a middle cuneiform. Fantastic. Coming off these are metatarsals, and then you've got your toes. Your toes all have phalanges. 4 of your toes have 3 phalanges, and your big toe only has 2 phalanges. How do you suppose we're going to talk about phalanges? Because you've actually got 14 of them. Right? Can you guys see my pointer? How would I talk about this phalange right here? How are we going to describe that one? Ms. Fleeks, the sooner you still have your hand up, do you have an idea?
Oh, no, sorry.
Okay. Let me ask you guys this. Let's just name the toes first. We'll name the big toe 1, next toe 2, 3, 4, 5. Okay, so the pinky's 5.
Phalanx?
Yes. Phalanx or phalange, yes. So this phalanx, this phalange, is number 1, okay? But so is this one. So how do I tell the difference between these two phalanges? Miss Petrie.
Inferior, superior?
No, because they're not inferior or superior. Miss Petrie, good guess though. You guys have words for these.
I'm not sure.
You're not sure? Okay.
Distal and proximal.
What?
Distal and proximal.
Distal and proximal, what a great idea. Because one is distal phalange number 1, and proximal phalange number 1. Okay. So if that's true, by the way, it is true, Miss Hanson. If that's true, Miss Hanson, if I go down the little toe, right here on the tip of the little toe, what's that? If I go to the tip of the little toe, what's that phalange?
That would be distal.
Distal what?
Phalange?
Yep, number what?
5.
Yeah, perfect. Guys, she just told you how to name phalanges. That would be distal phalange number 5. Your little toe on the tip. Now, what about this one that's over here? Distal phalange.
Proximal.
Yeah, proximal phalange number 5. And what do we call the one in the middle?
Medial?
Middle. It's not medial. Medial means towards midline, but it's middle. It's between the two. Middle phalange number 5. This is true for my hands too, everybody. This is true for my hands too. So this, you might want to look up here because I'm going to ask you this too in just a second, just to warn you. This is distal phalange number 1. This is proximal phalange number 1. This is distal phalange number 1, middle phalange number 1, distal phalange number 2, middle phalange number 2, proximal phalange number 2. Does that make sense? Good. Miss Petrie. What one is this?
That would be.
Take your time.
I like how you called me on this one, but this would be phalange number 3, and that would be the distal.
Perfect. Yes. Thank you. It's distal phalange number 3. Yes. Really good. Very good. Miss Hunter, which one is this?
Sorry, I'm looking at the slide. Anyway, can you repeat that?
Sure. Which phalange is this one right here?
On the hand or the foot?
On my pinky that I'm showing.
5.
5. But there's 3 phalanges here, so which one is this?
Oh, not the proximal. I don't know.
Not the proximal, that's right. What?
Oh, I don't know what the end part is called.
Well, it's the one that's more distant.
Oh, distal number 5?
Yep. Distal number 5. Proximal number 5 is here, and what's this one in the middle called?
Middle number 5.
Yeah, middle phalange number 5. Cool. Good job. Yeah? How are we feeling about this? Huh? Mr. Tate? Mr. Tate?
I feel great.
Good. What is, Mr. Tate, what phalange is this right here?
That would be 4. The first one is distal phalange number 4.
Yeah, perfect. Distal phalange number 4. Thank you. And Miss Walker?
Yes.
Yeah, which phalange is this bottom one right here?
That is proximal phalange number 2.
Bam! Awesome! Good. I'm very happy about this. Miss Moore?
Yes.
Which phalange is this right here?
Proximal number 1.
Yeah, proximal phalange number 1. Good job. Thank you, ma'am. Good. Miss Petrie, did you still have a question? You just have your hand up? No? Okay. All right, well, that was kind of cool. By the way, we're going to see this labeled in the slides, but I just kind of wanted to show you guys that you can almost kind of use your language to kind of figure some stuff out, right? We've already figured out how to name the cuneiforms and the phalanges. By the way, the metatarsals are numbered 1 through 5 also, because you've got 5 metatarsals. Those come before the phalanges. Yeah. So let me ask you this. On the foot, You might want to look up here. It might help you at me. These are the phalanges up here. These are the metatarsals here. What do we call this joint between the metatarsal and the phalange here? What do we call this joint right in here?
Metatarsal phalange joint.
Yeah, metatarsal phalangeal joint. Cool. What do we call this joint between the two phalanges right here?
Phalangeal joint.
Interphalangeal joint, between the phalanges. Interphalangeal joint. That's on the big toe, by the way. What would we call this joint on the next toe over that's between the last two phalanges, the middle and distal phalange? What would we call it?
Would it be the middle phalangeal joint?
There's not really a middle phalangeal joint. There's two interphalangeal joints here. There's two. So what's this last one called?
The distal?
Distal interphalangeal joint number 2. Proximal interphalangeal joint number 2. Metatarsophalangeal joint number 2. And I hope that makes sense because this will be on your homework. So, Ms. Yanez, what is this last joint called between the last two phalangeals on my little toe?
Distal interphalangeal joint number 5.
Yep. What's this next joint down here called?
Is that proximal?
Proximal what?
Interphalangeal joint number 5?
Yes. What's this joint down here?
That's the metatarsal phalangeal joint number 5?
Yes. You nailed it. You nailed it. You nailed it. Yeah. And by the way, just to let you know, like where the tarsals, where the metatarsals meet the tarsals, that's tarsal metatarsal joints, right? Because those two joints come together there. Sorry. That's just the way it works. All right, let's move along and look at some other stuff in this slide here. Then we'll take a little breaky.
Wait 1 second.
Yeah, please, please, please. Please.
Say the last tarsal joint.
Oh, sorry. So you're right. We're going to look at a slide of it. That's why I kind of glossed over it. But where the metatarsals come down and meet the tarsals, those 5 tarsals, we often call that metatarsal tarsal joints. Right? What if I have a picture of it? Hold on. No? We do. Hold on, bear with me. Yeah, I'll show you one in a minute. But anyway, the point is you name the two bones, right? You got metatarsals meeting tarsals. They're metatarsal tarsal joints. Yes, Miss Petrie?
So as you're showing Miss Yanez on your skeleton foot, are the proximal phalangeal joints, is that not the same as the location of the proximal phalange?
Yeah, good question.
It looks like it was kind of opposite.
I know. Can I draw something on the board to show you guys? It'll really help. So I'm going to stop sharing this. Just take a look with me here on the board. I'm going to use a hand just because it's easier and the hand has phalanges. And by the way, the hand has the exact same number of phalanges. Like your big toe's got 2, my thumb's got 2. All your little toes, your other toes have 3, all my other fingers have 3. Okay? They're identical. So, here's what's confusing, right? Let's draw a thumb. How do we do this? Let's see. That was terrible. You guys cannot let me draw. All right. If this was a hand, by the way, down here you've got 8 carpals, but don't worry about that. Okay. This is a hand, believe it or not. This is the thumb. These are your metatarsals. These are here. In your hand, they're called metacarpals, but it's the same thing. All right. So we number these, right? What number is this?
1.
1, 2. Jeez, I don't like the thing at all. All right. Let's try this again. 1, 2, 3, 4, 5. So my thumb is always number 1. Pinky is always number 5. Right? These are all the phalanges. Right? Which phalange is this?
Proximal. Oh, distal, I'm sorry.
Distal phalange number 1, right? D. Which one is this?
That would be proximal.
Cool. And what is this one right here?
Middle.
Middle. Cool. All right. Your question was an excellent one, Ms. Petrie, and so I want to kind of help just organize this in your head. So this is kind of convenient, right? So this is proximal P, proximal phalange number 3, right? Okay. What gets a little bit confusing, even though we all know it, is we name stuff by what 2 bones come together. So, shoot, I don't know which one is good. So, this is a joint between 2 phalanges, right? This is a joint between 2 phalanges, correct?
Yes, sir.
Okay. Wow. This, let me get a different color. This is not a joint between 2 phalanges. This is a joint between a phalange and a metacarpal or a metatarsal, depending on what we're talking about.
Yes, sir.
Okay. So I only have a distal and a proximal interphalangeal joint. I've only got 2 interphalangeal joints, so I can call this one distal and I can call this one proximal. The distal one is between the distal and middle phalange. The proximal one is between the middle and the proximal phalange, but I wouldn't even put that in my head. I'd just be like, there's only 2 joints here that are interphalangeal joints where 2 phalanges come together. So I only have to differentiate between those 2. On this one, by the way, is this a distal or a proximal interphalangeal joint? Number 1. Miss Petrie, is that distal or proximal interphalangeal joint number 1? He said with what?
I think I'm going to say distal, but I don't know if I'm right.
Why don't you say screw you, Tapscott? That's a trick question. Neither one of those answers is right.
Okay, well then screw you, because I know one of those answers are right.
I don't need distal or proximal because it's the only one. Because down here is a metatarsal or a metacarpal phalangeal joint. This is the only interphalangeal joint number 1. There is no other, there's only one of these. There's 2 of these. There's 2 of these. There's 2 of these. There's 2 of these. So I've got to call them distal and proximal. This is just interphalangeal joint number 1. That's it. I don't need to tell you it's not distal, it's not proximal, it's just interphalangeal joint number 1. There's only one interphalangeal joint number 1. Does that kind of make sense?
Kind of.
Yeah. It's confusing because we just threw a whole lot of new stuff at you guys, but it's really old stuff. We name bones by what come together, and what happened was they said, okay, we're going to keep doing that, thank God. And they said, oops, well, we've got 2 interphalangeal joints. These are phalanges, so that's an interphalangeal joint. These are phalanges, so that's an interphalangeal joint. Shoot, we've got 2 of them. We can't call them both interphalangeal joints, number 2s. We could call them interphalangeal joint number 2A and B, but that doesn't make sense. Why don't we call them interphalangeal joint number 2 distal and proximal? Because we use words like distal and proximal all the time.
Right.
And that's why they do that.
Okay, thank you.
And by the way, you have homework in this. It'll all make sense when you do it. It's just the words get really long, like metatarsal interphalangeal joint number 5 on a Tuesday, proximal distal medially rotated. You know what I mean? You're like, oh God, Can't we just call it a frickin' toe? Yeah, I mean, I hear that. Yeah. Okay, cool. Cool. All right. All right. So we already talked about this stuff. This is the bottom view of the foot. Hey, what's those little bones up on the first metatarsal? Anybody see those bones up on the distal portion of the first metatarsal? What are they called? What does it say? Sesame seed?
Sesamoid bone.
Sesamoid bones. I've heard that somewhere before.
Set in the knee.
Oh, that's right. Your patella is a sesamoid bone. And I mentioned that you had 10 in your body. You got 2 knees, so that's 2. You've got 2 in the big toe, which means you have 2 in each toe. That's the other 4. That's 6 of your sesamoid bones. What is a sesamoid bone?
Does it kind of just float there? It is encapsulated by a tendon or something
Yeah,
like that?
encapsulated by a tendon. It's in areas of high stress. Your body is trying to keep bones from popping out and such. Would your big toe in that area be in high stress? Yeah, it's got to carry my butt around. You're darn right. That's a lot of pressure, especially when I come up on my toe. It's the same thing. It doesn't want my toe to pop out the wrong way. So I've got 2 sesamoid bones there. They're very tiny. And they're adorable, but they're there, and you can actually feel them in people's feet. 2 sesamoid bones there. Cool. Love it. Very cool. So that's 6 of the 10 sesamoids in the body. Very cool. Patella is obviously the largest sesamoid bones, right? These are tiny here. Guys, it's not that I'm against going over this stuff, but there's not much to go over here. We've got 3 cuneiforms, and we already talked about the fact that you have a medial one. Remember, there's a difference between medial and middle. Medial is towards the midline. Middle is between 2 things. Middle is between 2 things. The blue tape is middle to the red and yellow tape. It could be anywhere. Medial means towards the midline. So the inside of my feet are the most medial part of my feet, which is why the cuneiform that's on the inside of my feet is called the medial cuneiform. But the one next to it is called the middle cuneiform because it's between the 2 cuneiforms. Does that make sense? I hope. Somebody nod or don't nod. Tell me it does not make sense. Thank you, Miss Stanley. I appreciate you. Yeah. Okay. Here's a side version. This has your tarso-metatarsal joints that I talked about, which is just the joint between the tarsos and metatarsals. What do I care about all this stuff? All of those joints have mobility to them, and you should be trying to massage into each of them. Most of us don't think when we're running down a foot, we don't think like interphalangeal, distal interphalangeal, proximal interphalangeal, phlangeometatarsal, tarsal metatarsal joint, you know, tarsal, what do I want to say? Like transverse tarsal calcaneus joint. We're not thinking about the fact that there's all these joints in here and they can move around. We're just kind of rubbing the foot. I want you guys to get in there and like wiggle the foot up and get that stuff going and wiggle it around. And that's why I twist the foot when I work it. I'm trying to get into these joints in here. Get in there and work it. Cool? All right. I think that's it. Side view. Note the arch here. Note this outline around this foot. All that stuff in the middle is meat and fascia that you should be massaging. Tremendous amount in there in the arch. Okay. Question.